Hi, my name is Rob Matheny. I'm part of the Leadership and Organizational Development team. Last spring, I had the great honor of serving with you here at Wyandotte as we worked our way through the first COVID-19 surge. We know that that time was painful, horribly painful for so many of us and for our community. But alongside that pain, we saw an immense amount of courage and service and fortitude and resilience. We invited the film crew to come and bear witness to all that was happening here during that time. And we didn't know then how we might use that footage. But today, we've put this video together to honor you, to honor all that you did for this community, and to celebrate your hard work. We hope that watching this video will help you also feel a sense of pride, a sense of purpose, and a sense of connectedness to each other. That you can bear those feelings, those positive emotions, alongside the pain. We know that watching this is likely to be very emotional for some of you, but we hope that you also feel honored, that you feel supported, and you feel connected to this amazing band of brothers and sisters here at Wyandotte who linked arms with you. And so Wyandotte, we thank you.
We are Wyandotte.
This is our story.
This is us.
Now to growing concerns about the deadly coronavirus officially hitting the U.S. Here's what we know.
And officials with Metro Detroit Health System say we are on the front end of a surge.
Help us understand, now that we have confirmed cases here, what changes will be happening here in Michigan.
We saw reports in January, February, about the viruses in China. And knowing that it was a respiratory type virus, I know I was concerned, so I know with my leadership team we started talking about what if this starts to ramp up, what do we need to do?
We start to see these cases start popping up in the West Coast around Washington. And right around that time, I think we even had our first death in the country. Testing wasn't really available in the state of Michigan. It was essentially non-existent and had to go through very complex processes through public health to even get a patient tested.
We were starting to get a little bit worried. We got information that there were 2 cases in the state of Michigan when they first started. There was a high level of alertness. Everybody trying to get ready, get up to date on what they need to do, things were changing by the hour.
I remember the first day, you kind of anticipate that you're not going to see that many, and then we kind of started to realize we're going to see a lot of patients.
We went essentially from having none to it just felt like we just kind of imploded. So, every couple days we were having to increase the number of ICU beds that we had.
But what really stuck out to me was when we had a bunch of younger, seemingly healthier people that were just kind of flooded us, and that was a little bit eye-opening, and you started thinking we didn't really know what we thought we knew. That's what made it scary.
At the very beginning, it was fear. There was a lot of fear amongst healthcare professionals, our loved ones, the community. What was this? We didn't know. And very quickly, as the fear kind of came on, so did this PPE shortage and crisis, which added another element of fear, maybe even a little mistrust. There was a sense from both myself and others that we felt like maybe we were, walking into a burning building.
We were exposed all the time, potentially. We sat shoulder to shoulder sometimes with patients or other staff members, and we didn't know that they were sick. We didn't know that they could have COVID. So then before you left your shift, you changed into different clothes. You got into your garage, you took off all your clothes, you went right to the shower, but you didn't know what you were carrying that you could give to your family. So I think that was the worst time for me, because I just wanted to cuddle with my kids on the couch on the weekend, and I couldn't do that because I was afraid of, I'm really sorry, of what I could potentially be giving to them, because I wasn't sure.
The worst day for me was the day that I knew we had 6 patients who we were going to terminally wean off the vent, and I know our morgue only holds 4. So I had to make a phone call and say, if I have 6 patients who are dying today and our morgue holds 4, what are we doing with those patients? And I was told, there's a trailer coming. And that just kind of broke me. You know, that, to even think about that still, you know, that we didn't have the capacity for that much death. That was a hard day.
It was very heartbreaking to see the families, not only seeing their family member passing, but also the inability of them to be at bedside. That was pretty hard.
To hear Code Blue, over and over again. And some of my team members had never experienced that kind of death before and that kind of emotion before. And it was like, you know, you hear the Code Blues, you pray for the team, you pray for the patient and their families, and your team would kind of break down, so you had to jump in and be that super person, you know, give them some time to go outside and breathe a little bit and to come back in, and just keeping my team together.
And no one stopped. No one said, I'm not going. Everyone picked up their stuff and went and did whatever they needed to do. And I think that's probably the thing I'm most proud about our department, our hospital. Yes, you were scared. And I guess the true meaning of courage is that you're afraid and you're frightened, but you go anyways. And that's what they did.
We didn't know how easily it was going to be transmitted to us, if we had the right protection, if every day we were going to have enough of the right protection. We had to flip an 18-bed ICU unit into a 32-bed ICU unit, and not all of those rooms had the ICU capabilities, so we had to find the right equipment. We ended up using baby monitors for our rooms that weren't hardwired, so we could basically do the same type of monitoring for those patients. We wanted to get proning beds because we learned that helping prone these patients would help them get better faster. Well, by the time we realized that there's no proning beds we could get, so we had to write a policy on proning, come up with a protocol on proning, create a proning team, and we partnered with PTOT and respiratory. So we essentially, it was a big team approach through the whole hospital.
You knew these people's lives were in your hands, and all you could do was just like try at every little thing that could possibly help them. And it was scary, but because you weren't alone, it made it feel almost like, okay, we're doing this together. Now let's see, how did that work? How can we make it better? Let's move on to the next and keep going.
When this started, the severity of the patients who walked in was overwhelming, and that was the number of people that came in. They were just dire straits. And as we started to see patients coming in, but they weren't quite as ill, and we felt like maybe we were on the other side.
COVID has changed me as a healthcare provider and a person. It made me get a sense of who I really was. I've been a nurse for like 18 years, and I never looked at myself as being a nurse, but now it's like, I'm proud to be a nurse. I'm glad I made that decision years ago. I wouldn't change it for the world.
My band of brothers, my band of sisters, we've done this. We stood up, we battled, we learned, and we created the tools that I think can effectively continue to make this battle for weeks to months to come.
I've actually never felt as appreciated in 15 years as I did during COVID. They really reached out and just sent so much to us that was easier to come in every day and do that over and over and over again, no matter, you know, how tired you were, how scared you were, because they counted on us and we weren't going to let them down.